forth.
What do you do with your patients when they have a completely destroyed, excuse me, rotator cuff, and all that you see is the raw bone left on there, because now it's raw bone grinding in the raw bone? Tell us how you treat it.
I haven't fixed one of those problems since 4 p.m. today. But like you were talking earlier, if the ball and socket marry each other through the ligaments and the rotator cuff, and the ligaments and the rotator cuff have a tear or pathology, and there's a big hole in there, now the ball and socket are not in unison with each other. They are working against each other, and patient hurts. They can't, like you were saying, can't lift.
And they hear the grinding
It's only
noise.
6 inches from your ear.
Right. Patients report hearing the grinding. When you try to move their arm, you hear the grinding, and that just doesn't have to be.
Right.
But when somebody has a rotator cuff that's horribly injured from an irreparable tear, one that couldn't be fixed, or from other reasons, what's the modern way of fixing that? We used to try to fix it with grafts, and largely they failed.
We tried a lot of things, and we eventually, depending on the patient's age and their activity level, there's something known as shoulder replacement surgery that bypasses the rotator cuff.
Makes it not needed anymore.
Not needed anymore, because there's one more muscle, the outside muscle, we call it the deltoid. We take that deltoid into action and say, hey, Mr. Deltoid, can you help us do what the rotator cuff was doing earlier?
And they get pretty decent outcomes, don't they?
They get very decent outcomes.
Meaning that the pain drops down to really wonderful levels where the functionality goes up.
This is ironic. We are sitting in Rocky Mount. The first patient who had a reverse shoulder replacement surgery, I did it at Duke back in 2004 on 16th October at 9 p.m., but that's not important. He was a pilot here at the local airport, and he could take off and land with his injured shoulder, but he couldn't reach up and hit all those buttons. All he wanted to do was a pain-free takeoff and a pain-free landing. So we did his first reverse shoulder in the United States of America was a patient from Rocky Mount.
There you go.